Hi everyone, my name is Shanbal. This is very informative video about the uterine fibroid. Today I am going to tell you how to diagnose uterine fibroid, treatment for uterine fibroid, and also natural treatment of uterine fibroid. So stay with me. How are fibroid diagnosed? Fibroids are most often found during a routine pelvic examination. This, along with an abdominal examination, may indicate a firm, irregular pelvic mass of the physician in addition to a complete medical history and physical and pelvic and/or abdominal examination. Diagnostic procedure for uterine fibroid may include X-ray, electromagnetic energy used to produce image or bone and internal organ onto film. Transvaginal ultrasound, also called ultrasonography, an ultrasound test using a small instrument called a transducer that is placed in the vagina. Magnetic resonance imaging, MRI, a non-invasive procedure that produces a two-dimensional view of an internal organ or a structure. Hysteroscopy, visual examination of the canal of the cervix and the interior of the uterus using a viewing instrument, hysteroscope, inserted through the vagina. Hysterosalpingography, X-ray examination of the uterus and fallopian tubes that use dye and is often performed to rule out tubal obstruction. Endometrial biopsy, a procedure in which a sample of tissue is obtained through a tube which is inserted into the uterus. Blood test, to check for iron deficiency anemia if heavy bleeding is caused by the tumor. Medical treatment for fibroids. Since most fibroids stop growing or may even shrink as a woman approaches menopause, the healthcare provider may simply suggest watchful waiting. With this approach, the healthcare provider monitors the woman's symptoms carefully to ensure that there are no significant changes or development and that the fibroids are not growing. In women whose fibroids are large or are causing significant symptoms, treatment may be necessary. Treatment will be determined by your healthcare providers based on your overall health and medical history, extent of the disease, your tolerance for specific medication, procedure or therapies, expectations for the course of the disease, your opinion or preference, your desire for pregnancy. In general, treatment for fibroids may include hysterectomy. Hysterectomies involve the surgical removal of the intrauterus. Fibroids remain the #1 reason for hysterectomies in the United States. Conservative surgical therapy. Conservative surgical therapy uses a procedure called a myomectomy. With this approach, physician will remove the fibroids but leave the uterus intact to enable a future pregnancy. Gonadotropin-releasing hormone agonist, GnRH agonist. This approach lower level of estrogen and triggers a medical menopause. Sometimes GnRH agonists are used to shrink the fibroid, making surgical treatment easier. Anti-hormonal agents. Certain drugs oppose estrogen, such as progestin and danazol, and appear effective in treating fibroids. Antiprogestins, which block the action of progesterone, are also sometimes used. Anti-inflammatory painkillers. This type of drugs is often effective for women who experience occasional pelvic pain or discomfort. Uterine artery embolization, also called uterine fibroid embolization. Uterine artery embolization (UAE) is a newer, minimally invasive, without a large abdominal incision technique. The arteries supplying blood to the fibroids are identified, then embolized, blocked off. The embolization cuts off the blood supply to the fibroid, thus shrinking them. Healthcare providers continue to evaluate the long-term implication of this procedure on fertility and growth of the fibroid tissue. Natural treatment of fibroids. At home care, diet changes and natural remedies may help treat fibroids and relieve symptoms. The lifestyle changes below are also important in the prevention of fibroids. These natural treatments may or may not help your fibroid symptoms, since relief depends on how severe your symptoms are and how fibroids have progressed. You should speak with your doctor before trying any of these options. Weight loss. A clinical study in China showed that obesity and excess weight increase the risk of uterine fibroid. This happens because fat cells make high amount of estrogen. Losing weight may help prevent or reduce the size of fibroid. Nutrition. Your daily diet is a very important factor in treating fibroids. The right nutrition can help you maintain a healthy weight and reduce your risk. Certain foods can also help ease symptoms. Foods to avoid. According to clinical studies, eating too much red meat increases your risk of uterine fibroid. Drinking alcohol also increases your risk. Eating excess refined carbohydrate and sugary foods may trigger or worsen fibroids. These foods raise blood sugar levels. This causes your body to produce too much insulin hormone. Avoid or restrict simple refined carbohydrate like corn syrup, boxes cereals, potato chips, crackers, baked goods, cake, cookies, donuts, white rice, pasta and flour, soda and other sugary drinks. Foods to eat. Fiber-rich unprocessed food helps curb your appetite, balance hormones, prevent excess weight gain. Brightly colored foods such as fruit and vegetable also help reduce inflammation and lower your risk for fibroid. And there's whole foods to your daily diet. Raw and cooked vegetable and fruit, whole grain bread and pasta, dried fruit, whole grains, brown rice, lentils and beans, couscous, quinoa, fresh and dried herbs. Vitamins and supplements. Milk and dairy may help to reduce fibroid. Dairy products contain high amount of calcium, magnesium and phosphorus. These nutrients may help prevent growth of fibroid. Some types of vitamin may also help reduce the growth and size of fibroids. Research confirms that your risk for fibroid may increase if you have low amount of vitamin D and vitamin A from animal source, such as dairy. Uterine fibroids may worsen menstrual pain, bloating and cramping. A number of vitamins may help ease these symptoms. Vitamins and supplements. Omega-3 fatty acid, vitamin B1, vitamin B6, vitamin E, magnesium. You can find these vitamins in food as well as supplement. If you want to start incorporating supplement into your daily routine, talk with your doctor before you begin. Blood pressure. A Dutch study found that there may be a link between high blood pressure and fibroids. Manage your blood pressure to help reduce your risk and improve your overall health. Limit foods with added salt or sodium. Check your blood pressure regularly and discuss readings with your doctor. Get regular exercise. Green tea. A bioflavonoid in green tea called EGCG may help reduce the size and number of fibroids. This may be due to its ability to reduce inflammation and remove toxins from your body. Chestberry. Chestberry or white eggs is taken for heavy menstrual bleeding, painful period and other symptoms. This herbal remedy helps to balance hormone levels. Other remedies. At-home care may help to manage stress, which can worsen fibroid and your overall health. Try these treatment options that can help manage stress. Warm compresses or applying local heat, warm bath, yoga and exercise, massage therapy. So viewers, if you have any question about the uterine fibroid, please write comment below. I will try to reply you. Thanks for watching.